Thank you, Brian. And now I'd like to introduce our first speakers, Dr. Jack Henningfield. Also speaking with Dr. Henningfield this morning will be Dr. Margaret Dowell. And with no further ado, I'd like to introduce Dr. Jack Henningfield.
I want to emphasize the importance of what you're doing and the need for drug courts. Yesterday was a big day in my family. My brother met with his parole officer and completed 8 years in the Minnesota correctional system. The first 2 times he went to prison for making and selling methamphetamine. He mainly learned how to do a better job of making it and selling it. And the last time, he actually connected with a really good treatment program. Even closer? How is this any better? Yeah. Okay. How's this? Okay, so could anybody hear anything I was saying? So you heard that my brother's free out of the halfway house, but it took a long time. There wasn't a good treatment program. There wasn't, he wasn't dealt with in a way I think that was helpful to him or helpful to society. So he was a cost to society and a burden, and now he's been on a different path. Treatment connected, a good recovery program connected. This affects all of us at every single level, and I'll show you more ways about that. I'm a scientist, not an artist. I study the biology of addiction, and from a biological perspective, addiction is an orderly process. It's drugs impacting the brain, and the brain then responds. Some of you have heard about Congresswoman Gabrielle Gifford's recovery. She's being able to recover to a degree because the brain is not just a lump, it's plastic. It can grow, it can change. In her case, that's great. For the person that connects with addictive drugs, that's terrible because the brain starts to change. And I'm going to talk a little bit about that, but I'm going to show you the process a little bit through art. On your tables and available is a pamphlet from the National Institute on Drug Abuse, my old institute, and that shows you more of the hardcore science. I'd like to illustrate it with art. We started this with funding from the Robert Wood Johnson Foundation in the early 2000s, and I thought, why couldn't we show art at addiction and drug dependence scientific meetings? It turned out to be a big hit for the scientists. They loved it, and others loved it. And then I worked some into a medical text, and the publisher thought it was kind of weird, and the reviews were great. So I started using it in lectures. And sometimes I'll give a lecture for scientists, and they'll say, I love the art you showed. It connected. So the project has really grown. So I'm going to give you some of my perspectives on the science of addiction, and then Dr. Dowell will show you where the rubber hits the road, how this is actually making a difference right now, and how you can use some of this. You're already using some of it. The HIV quilt helped connect people with the disease of HIV, the humanity of HIV. Some of you can remember, like I can, when HIV hit like a bombshell. It was scary, it was terrifying. What is it? Will I get it? It's just those people. I was working with Surgeon General Dr. Koop at the time. He was struggling with some people in the administration who said, let them go to hell in a handbasket. They're drug addicts and homosexuals, and they did it themselves. Others, like Dr. Koop, said, I'm Surgeon General for all the people, and it's in the interest of everybody in humanity to do what we can to help. Art, though, helped make it happen. Art was part of the process of changing attitudes. Addiction and recovery are balancing acts. It's a balancing act in the brain as the brain connects with the drug. For the drug abuser, it's a balancing act as they're trying to find the balance when they're using drugs, getting the right high. Sometimes they're mixing drugs to a disastrous end, trying to a little bit of this and a little bit of that, trying to get just the right effect. And sometimes that deadly experiment in pharmacology turns deadly. Any of you ever visit the sites such as Blue Light or Arrowhead? They're kind of like the science for people that want to get high. It's a scary world of how to abuse drugs out there. But a lot of it is finding the balance. Recovery then is trying to find the balance. And no one wakes up and says, I'm going to try smoking or heroin or another drug and then just keep using it the rest of my life. I'm going to try a cigarette and smoke 1,000,000 more. They generally begin with a single trial, and often without an intent to continue, oftentimes in a social setting. The next step, unfortunately, and the next step and the next step is a progression. Not everybody progresses. And one of our problems in prevention is young people look around and say, well, a lot of people are using it and they're not addicted. And they're right. At that point, a lot of others aren't addicted. So it's easier to slide down that path. I love this work by Ray Matterson. He did it while he was in prison with sock thread. It's needlepoint, little tiny needle points about 2.5 by 3 inches with sock thread. Most drug abuse starts in a social setting. And it's not just about the drug and the pharmacology and the molecule in the receptor in the brain. It becomes part of life. It starts as part of life in social settings, and it continues in a social setting. For some, the addicting drug provides what they've been looking for. They didn't feel right. Young people with ADHD are twice as likely to become cigarette smokers. The nicotine actually does something that's helpful. Now, it's a terrible way to get help, but to the person starting the drug, for a lot of them, it's okay, I finally feel right. The illusion of reality, what is real? And that changes. As the brain changes, what is real changes. What is important in life begins to change. And some of this is just flat out biology. And it's changing the brain. And the drug abuser doesn't even realize it. They just feel normal. Some of them will say, you know, it's not that I'm trying to get high, I just feel on the norm. I feel better. I work better. I function better. This is another work by Ray Matterson that was in our Hopkins medical textbook on addiction treatment. He did this after he came back to his prison cell, and he didn't know that his cellmate was injecting heroin every afternoon. He just knew that every afternoon his cellmate wanted private time in his cell. In the prison system, he lost friends to overdose, and in one case, somebody who couldn't pay off the people that were providing him with his drugs in the prison system, and he was killed. The pleasure from drugs is real. And a lot of times people say it's just psychological, what's wrong with you, it's not important. Well, if you can think, if you can love, if your brain is wired to respond to sex, to food, to things that are reinforcing. And you've got this wiring, we all have it. We all have some vulnerability to becoming addicted to a drug. During Vietnam, the rate of heroin-related addictions skyrocketed. It was a terrible setting, and the drugs were readily available. Within 5 years of coming back, most of the people that were hooked were able to beat it with some help. And it's a combination of the setting, the access, the circumstance, and then the drug starts taking over in the brain. And feeling better is part of the effect of the drug. And the NIDA pamphlet that is here will give you more of the latest science on that. And some people describe the effects as small rewards, especially in the case of cigarettes. It's just a little pleasure. What's the big deal? They don't understand that the brain is actually starting to change, and that now this is starting to become what the brain wants and needs to function. A lot of the early experiences are described as just flat out fun without an understanding of what they may lead to. This work was on the cover of at least one magazine, and it was shown in one of our exhibitions. But as we know, and there's a lot of focus here, the real deadly consequences of driving under the influence. My pill girl, I'm going to read what the artist said. This is from our book. She said, "I used to believe that to produce art of any value, I had to be on pills. It took years for me to get over that association." So for her, taking pills were part of her art. It was part of what she thought she needed. This is a work by Margaret Dowell. When we were having our conferences and our addiction art galleries, she submitted this work, and it was a big hit because it was fighting back the balancing act with prescription drugs. Now, I do work with the Food and Drug Administration and with other scientists and with pharmaceutical companies on trying to find the right balance with prescription drugs. How do we make sure that people that need pain medications can get them and don't feel like criminals when they go to the pharmacist, and that the pharmacist doesn't feel like he's a cop or she's a cop, but that we reduce access to abusers? That's threading a moving needle. When years ago at NIH, I was asked to give a lecture on the science of nicotine addiction for the public, and they said, "You can't use data slides." I said, "What do you mean? That's what I do. I'm a scientist." They said, "No, we're going to assign an artist to you, and she will help illustrate the concepts." So I said, well, the brain has nicotine receptors, and nicotine affects those receptors, and the brain fights back. In the case of nicotine, the brain grows extra nicotine receptors, up to 400% more nicotine receptors. Now, some drugs decrease the receptor targets, others increase them. The point is, they change the brain. And I love what she did with it, because at a certain point, the receptors don't feel right. They need to be fed. Feed the receptors. And whether it's cocaine decreasing receptors and now the brain needs more drug to function normally, or nicotine increasing and now you've got more hungry receptors, the effect is the same. The brain needs a drug to feel right, and it's going to take a while for people to recover. Brian Kelly, the artist, said, "In every smoker's life there comes a day when they realize they cannot quit. It is a rare smoker who walks away the victor the first time they make a resolution to quit smoking. I believe that the road to recovery would be more accessible if it were paved with understanding." My Kingdom for a Horse, I'll read what the artist said. "This represents the desperation felt by the fallen. They have lost their way in this horrific hell of drugs, thinking in a self-deceptive way that using drugs would make them feel better. He is at the point of sacrificing his own life just to return to the light once again." Angst, a retired narcotics investigator, he wrote, "I believe that empathetic listening can promote mutual healing and mutual understanding of the most painful of conflicts." Kayla's grandma, and still smoking. Junkie's misery. So there's a transition from this early social, it's fun, to a situation that even a lot of the drug abusers who are using don't like, but they're trapped. This is fascinating. This is a map of a borough in New York City. It was about, I don't know, 8 or 9 foot by 8 or 9 feet in the American Visionary Art Museum. It's made with crack little glycine packets. And even with drugs like crack, it's partly about marketing. They all have different images, they have different names, crazy names, you know, Star Trek, Hell, Nirvana. It's something for everybody. But drugs are marketed. A lot of people that do science, and this comes out of some of the studies from our laboratory, we actually look at images of the brain. We can see how the brain changes, and a lot of the scientists that do the imaging work have it hanging some of their favorite images on the wall. It's, some of it, I think, is beautiful art, but this actually is your brain on cocaine. In our nicotine studies, we could see when the person was taking nicotine, when they were in withdrawal, and when the brain was beginning to dysfunction, and when they were saying, you know what, I can't quite concentrate now. Some of the brain recovery takes a long time. We don't know that everybody fully recovers. So some people say, well, wait a second, you get off the drug, then it's all psychological. Well, the physiological effects can persist for days, weeks, months, and maybe for years for some people. So we need a strong recovery system that is there for the life cycle. And the hurt is, a lot of the myth is it's just me, who am I hurting? But as we know, it hurts a lot of people. It hurts family members. It hurts others in society. The images here in River of Tears, it's probably hard to see them, but they're images of the person's family. Let me read what the artist said. My father gave up his fight against alcoholism by taking his own life. How many rivers of tears have been shed because of addiction? In the river of tears are those most affected by his act, his children, his wife, and his mother. We were left with shock, sorrow, and pain. Fast exit. Carol Russell wrote, my artwork is an exploration of the universal. Addiction touches everyone. I have family, friends, and acquaintances who have struggled. Some have been lost. I hope that my art, as an expression of my own questioning and bereavement, will help to awaken some mutual recollection. 0 refills left. The artist, Dara Cummings, wrote, from conception, I knew this piece would spark questions in everyone, signifying either a long drawn-out battle or the instantaneous loss of someone you love. Someone without too much notice has slipped from, once again, a strong grasp of reality. Why don't we secure medicine cabinets half as well as gun cabinets? And by the way, my own institute, that was part of what we were promoting with SAMHSA, the Substance Abuse and Mental Health Administration, which is basically clean out your medicine cabinet. That's where a lot of young people get their prescription drugs. This artist was right on the mark with it. Flacco and the Prom Queen, childhood image, another one from Ray Matterson. Busted by the Task. And this is one of the challenges. How do we, when somebody is busted, how do we turn that into the beginning of a new life and not graduate school to really learn how to make, deal, and sell? This artist, an oil portrait artist, documented her sister's fall with 13 oil paintings, and she showed several of them in our galleries. This is her sister 3 months before her fatal overdose, and at the autopsy. For the artist, it was part of her recovery. This is really fascinating. We held a conference at Johns Hopkins on getting interventions in trauma centers and emergency rooms, and it was very controversial. One of our fellows in the Innovators Awards program helped get the American trauma surgeons to come up with a policy that if you were going to be endorsed as a trauma center, you had to do this. But it was very controversial, and most people in the emergency room saying, treating addiction is not my job. And we weren't asking you to become full-fledged treatment, but when you've got somebody in there that's drunk and almost killed somebody, or maybe dead, this is a teachable moment. Introduce them to the treatment system. So we commissioned a gallery of roadside memorials in the Baltimore, Washington area. And I set them up all over the conference room, and I opened the conference showing them. And I just said, look at the images. I said, we're here because we all know the statistics, which is that if we offered minimal intervention, some of these wouldn't be up there, because so many people drink and drive and drink and drive and do it again and again and again. And when they come into the emergency room, if the doctor says, look, you just about killed somebody, we can help you, a lot of them will say, get out of my face, doc, I don't want to hear it. But at that moment, a lot of them will say, you're right, it's time. But that artwork helped change the conference. After that, nobody said we can't do it. It was more, how do we do it? So freedom from drug abuse can become as simple as a change of lifestyle. For some, it is years and years of struggle. It's a struggle the rest of their life. Unfortunately, it remains easy to get drugs and hard to get treatment. Dr. Koop, when he was Surgeon General, we worked a lot on this issue with tobacco and with other drugs. He said it's easy to get drugs, hard to get treatment. As a nation, we must reverse this. We still have a long way to go. But it's really exciting when it starts to happen. And it can happen when everything comes together. It took my brother his third prison term to connect with actually a treatment and recovery program that made a difference for him. With a physician, and a lot of physician anesthesiologists slipped down the path to addiction. Part of his recovery was his bronze sculptures of the steps. Prodigal son. Let me finish up here. I want to read what the artist said. This was shown in one of our galleries. It's a 6-foot fiberglass. It is stunning. She wrote, prodigal's dream. If a father could be perfect, if a father could love long, if a father could forgive, he lift my hand with steady hands, tell me my life's worth living, that he loves me as I am. Then I'd stretch across that empty canyon span, and I'd come back to him. We can all help. We can help with more drug courts. We can help making recovery and treatment programs more accessible, and putting it all together. And Dr. Dahl is going to talk a little bit more about this. But let me tell you what the artist wrote. By creating this artwork, I'm trying to appeal to society for the need for awareness and compassion. I believe the more we understand about the causes that perpetuate substance abuse, the better we will be able to deal and cope with the problems, the solutions, and their effects. I believe that even the world itself and everyone in it is in some way hurting. We are all deeply in need of attention and recovery. It's not a simple problem. I study the pharmacology, what happens at the brain. That is a tiny piece of this pie. I love this. You just look at it and she's saying, you know, I did it, you can do it, we can do it. Well, I mentioned we worked some of this art into an addiction treatment book, a medical text on the science and medicine, and the publisher thought it was kind of weird. I wanted to get art in there, and the art was reviewed really well. And so they came back and said, will you do a book just on art and essays? And we thought, that'd be amazing, but we don't know what we're doing in the art world. So we thought, Dr. Dahl, she's a professor, she's an artist, she was one of the award winners in our galleries, and we asked if she would team up with us. And I want to tell you or introduce her now because she took it to the next level, and she's making this make a difference in the real world. My other colleague on the this book that we all did together is with the Substance Abuse Mental Health Administration, and they're bringing it on the road, and it's being very well received. So thank you very much, and Dr. Dowell.
I want to begin by talking a little bit about the book and the way we proceeded with that, and then I'm going to talk to you about the happenings since the book. The book was going to be a picture book. We needed to put a, quote, human face, human experience on the world of substance abuse and addiction. And we were going to do that through art. And in order to do that, we needed artwork. So we began with a national call. In the fall of 2007, we put out a call. Works were due in 2008. What happened was we got 1,000 entries. The entries came from all over the United States and abroad. With 1,000 entries, we had to pare them down for a book. And to do that, we selected an art advisory board. And the art advisory board is pictured on the screen in front of you. This board was comprised of 10 members from the addiction science world and 10 members from the art world. And they were stellar individuals, stellar. The people from the addiction science world included Sharon Walsh, who was then the president of the College on the Problems of Drug Dependency, and Fred Lazarus, who was the president of MICA, which is the Maryland Institute College of Art, one of the most prestigious art schools in the world. The probably the most famous person we had on board, sitting in the middle of the group, you may recognize the former Surgeon General, C. Everett Koop. It was such a great privilege and honor for me to work with someone that I had so much respect for a very, very long time. Anyway, 2 days of thinking, talking, experiencing these two different worlds, we came up with 61 images. The book was published in 2010. And what I'm going to talk about next are the sparks that happened once that book hit. The first spark hit me. When we were doing the call for the book, the artists were required to submit not only their image, but they were required to submit a statement that went with each artwork saying what the meaning of that work was, the relevance to them. What I did was I took a summer and I read every single one of them. I read 1,000 of those statements, and I took notes because I wanted to know what they wanted us to know. What do all of these artists that are submitting all of this artwork, what's really, really important to them? And this is what I found. I found that the most important thing to this group of people was the fact that the person who is considered to be the addict is a valuable human being. They are not a morally weak person. They are not a criminal. Okay? They are a valuable human being. And that thought was coming from artists who were the parents of someone who was addicted. It's coming from maybe the person who was addicted. Coming from someone they worked with. Maybe their medical provider. In one case, it was a funeral director. But the message was consistently the same. This is a valuable human being. They also wanted to know, second on the list, was what an addiction feels like. When we look at someone who has an issue with a substance, we can't necessarily tell the depths of that issue. But through art, you can do things that are different. So they wanted us to know that. These artists were saying, we want you to know what it feels like. And these weren't just people who were in the throes of addiction. These were their parents. These were their children. Okay, they wanted the world to know what their loved one felt like. Third on the list was that recovery sponsor. And what was interesting to me was that most of them were echoing what the current scientific findings have said, which is that it's a chronic disease. It's something that they're going to deal with for the rest of their life. It's a chronic illness. And these people got that, and they were telling me that in their statements. And then there were lots of issues, but this was the fourth one, the last one I'm going to talk about, and something that you totally are on board with and understand, and that is that people who abuse substances can cause grave damage. Another spark. Prior to the book, Jack and Pat had been doing exhibitions at conferences, professional conferences like this one. The exhibitions were very well received. It was time to take it to another place. It was time to take these shows into the community. At that time, I was teaching for a university and community college. And I went to the community college because I thought the venue was probably more appropriate. I went to the Carroll Community College, and I talked to the administration, and I said, we're doing this book. What do you think about taking some of these images and putting them on the wall in your gallery? Administrative response was, well, yes. How can we not do it? How can we not do it? Because last year in this small rural county, 30 young people died of an Oxycontin overdose. How can we not try art? This is what happened. And this is what happened. And this is what happened. That opening was not only the biggest art opening that this college had ever experienced, it was the biggest event this college had ever experienced. The event was about dialogue. The event was about looking at art, talking about art, what can we learn from art, how can art help us? Eric Marsh participated. Eric Marsh is in our book. Eric Marsh is a funeral director. Okay, he did the painting Addiction Savior because he buries addicts. That's what he does, a whole lot of them. And he thought that by doing this work, he could help a little bit. He could make a little bit of a difference. He participated in our exhibition. And one of the things we did in our exhibition was instead of putting name tags on the artists, remember this is about artist dialogue, instead of putting name tags on the artists, we put a reproduction of the artist's work on the artist. So that people walking around the space could immediately identify the artist with the work and dialogue would start. This particular show was of the community, by the community, for the community. It was not a traveling exhibition. And this is what I have learned. I have learned that any show related to this topic has to be like that. It has to be of the community, by the community, for the community. We can't take the works from our book and put them in your community and have a whole lot happen. That's what I've learned. Okay? In this particular image, the gentleman to the right, his name is Scott Gore. He was my boss at Carroll Community College. He was in charge of the Visual and Performing Arts Department. The gentleman to the left is his friend Brandon. He and Brandon collaborated on this piece, which addressed Brandon's heroin addiction. And that piece was included in this show at Carroll Community College. If you'll notice to the left of Brandon, there's a piece of paper on the wall. The piece of paper on the wall was a statement about this particular work. That echoed what we did in the book, which was to have an artwork and then statement, so that we are communicating with people both through the visual and the written word. The show at Carroll Community College included 3 populations. We had 3 galleries there. We did one gallery of professional work, we did one gallery of community college student work, and we did one gallery of high school work. This is an example. This is taken from the high school gallery. That show resulted in a whole lot of press. Okay, pictured here is the president, Dr. Faye Papalerdo, to the left. She's the president of Carroll Community College. She's the one that, as soon as I gave her this idea, she said, yes, we're doing it. She's speaking in this image with the president of Frederick Community College. And this particular conversation was put on cable TV. And like I said, a lot of press. We've had at least 6 or more articles in local newspapers about what was happening at this college. Okay, another spark, G40 The Summit. That was a huge 5-story art extravaganza that was all about lowbrow, pop surrealism, graffiti art, young people art. They asked us to put on a little addiction and art show. They wanted an addiction and art presence at that particular show. The show, G40, was sponsored by a gallery in DC called Art Wino. Okay, this was our room. They gave us a little room. We took some of the artwork from Carroll and some other places, and we put it in this little room. It wasn't a very big display. This was what the outside the room looked like. Okay, and all of those people, it was packed, 5 floors of people, and all those people made their way into that room. and the response was phenomenal. Another show, opening, 110 degrees that day, okay, and all these people were in a second floor gallery, packed, just packed. Okay, these are the shows that have happened in public places to date. Look at Delaware. Delaware Center for the Contemporary Arts. That's a very, very reputable art gallery in Delaware. It's got an international reputation. Okay, look at the dates, 2009, 2010, 2011. They did the first show was a hit, they did the second one was a hit, and they've done a third one, and my bet is they're going to have another one this year. Okay, they know it works. Look down at Florida, Tallahassee, Florida, Tallahassee, Tallahassee, 3 times. Look at Maryland, 2010, 2011, 2008 was the first one that we were associated with. Okay, look at Illinois, King County Drug Court. They did a little show in the Jurors Lounge. Okay, an addiction and art show can be any size. It could be at a museum. It was at the Museum of Fine Arts in Tallahassee, Florida. It can be at a church basement with 3 artists. Doesn't matter. The idea is to show art, have people talk about it, learn from it, grow from it, evolve from it. This is a list of the conference exhibitions. The earlier ones on 2006, 2007, 2008, they were the ones that Jack and Pat were instrumental in beginning. It was their brainchild, and then things are just kind of moving up. If you'll see up at the top, an upcoming one in September in Washington, D.C., the International Nurses Society on Addictions, at their annual education conference, they're going to have an addiction and art show. We're going to be putting out a call for that soon, and those works will be there for them to discuss, learn from, etc. The book also inspired a website, and there are cards on your tables the little business cards have the website there. The website is basically a resource, okay, a resource that connects with things that have grown from the book. When you go to the home page, you'll see something like this, which changes periodically, but what it has on the menu is it has information about the book we've done, but it also has information about shows that have happened. There are videos and pictures and newspaper articles, all of that show. There's a newspaper article from the one in the drug court in Illinois. Okay, there is a guideline on how to do art exhibitions. If you want an art exhibition in your community, you go to the website, you go on show guidelines, and there you have it. It'll talk you through how to do an exhibition if you want to do one. There's a curriculum guide on there. And I'm going to talk about that in a minute. There is, and this is the big thing that will really help you, I think, there's a download gallery. The download gallery is comprised of images that have been submitted to our site from artists all over the world. This site is fairly new. The imagery is starting to grow. But what is good for you to know is that these images are free for you to use. Okay, these are images about substance abuse. They have been created and given to you for the good of mankind by these artists. They're not getting anything from it. They're saying that we need these images, we need to put these images to work, and they are a gift. And you can find these gifts on our website. Along with each image, you will find a statement so that you get this background, the backstory. Why did these people create this in particular image? The curriculum guidebook. I'm an educator, I'm an art educator. And one of my visions when we were doing this book was that there needed to be a curriculum guidebook. But I'm a pretty busy person, and I knew that was going to take a long time, and I didn't know when in the world I was ever going to get around to that. Okay, people at Florida State University picked this up. There was a team of art educators, art therapists, filmmakers, students that were down there that met, and together they put together this curriculum guide that is for both art educators and guidance counselors. This is an example of a lesson plan. These lesson plans can be used in the public school system, but they can also be used in any educational program. So for those of you that are into doing education, you can pull this right off of our website. Okay, lesson plans for art teachers and lesson plans for guidance counselors. Okay, they're there and they're different. They're very different based upon the population that needs them. This guidebook, this K through 12 guidebook, was presented just a couple weeks ago at the National Art Education Association. I had the privilege of being in New York City with the team from Florida State University, and we talked with people there about how they can put this to use. It has been used in Florida, in the state of Florida, and the people at Florida State University are working on getting grant money to test this guidebook and to try to get it into other states across our nation. This is the potential they see. This is why they're interested in it. They think that, this is what the people from Florida State were saying at the National Art Education Conference. They said that the viewing and interpreting and creating artwork has the potential to complement the programs that are already in existence in the schools, the DARE program, the Red Ribbon Week, and so forth. A good complement. Also, this particular guidebook is culturally inclusive, and that certainly meets one of the demands of their profession. Okay, I want to give you a few tricks. I want to give you a few tricks about using art as dialogue. Using art to talk with your clients. We have a lot of artwork, and you can certainly put an image in front of somebody and ask them to start a conversation. You can ask them how it makes them feel or so forth. But I'm going to suggest that you kind of back up before you do that, and you give them a little bit of time to consider this image. And so I'm going to show you a little very, very easy 3-step trick to using art to address different topics with your clients. I'm going to use this piece called Inheritance by Kevin Grass. Kevin is a professor down in Georgia. This is a very, very large, it's actually a drawing. The first thing that I'm going to suggest how you can use this in a dialogue situation is not talk about what someone is getting from an image first, but asking them what they see. When they look at an image like this, what are you seeing? And it can be just simple things like I'm seeing a drawing, I'm seeing a painting, I'm seeing a sculpture. I'm seeing a drawing of 4 men. I'm seeing a drawing of men that are laying down in a box. I'm seeing a drawing of men that are passing a bottle from person to person. I'm seeing a drawing in which the man at the bottom is stopping that. He's got his hand up, he's stopping that. Okay, that's what I'm seeing. So you can start with a description. What is it that you're seeing in an image? And then you can go to what you think the artist is trying to say. And there is no wrong answer to that. There is no wrong answer. Because when someone looks at an artwork, what's happening is the artist's history is meeting the viewer's history. And that's when the spark happens. The artist's history meets the viewer's history. Okay? This artist's history was that, he came from a family that just drank. Okay? That's why he called it inheritance. And he's stopping the cycle, okay? That's where he was coming from. But your client may not know that, so they're going to be interpreting it. What do you think the artist is trying to say? And before you give them a chance to talk about how they feel about something, you ask them how the artist feels. What were they trying to communicate? Why was that important to them to communicate? Okay, and then ask if it resonates. Does that image resonate with you? Why does it resonate? And you have a discussion about that, or why not? Why does this not touch you? Why are you not getting anything out of this? Okay, and just all about conversations. Here's another image, distilled by Valerie Patterson. Okay, what do you see? See 2 little kids. One looks depressed, one looks like he could be a troublemaker. So there's a probably a father figure in the background, maybe. What do you see? What do you think the artist is trying to say? That's up to you. Okay? The artist has put down what is part of their history. Okay? Valerie has put down what is part of her history. It's when your history hits that history, your understanding about what this picture is about, that's when the meaning happens. And then does it resonate? Why or why not? Can you use abstract work and do the same thing? Sure. Okay, you might have to approach it differently. Most people tend to be very narrative-oriented with this type of work, but that doesn't always have to be the case. This particular piece is by an artist named Catherine Mann. And Catherine Mann's a DC-based artist. The title of the piece is JoJo, which is uncle in her language. She's from Taiwan. Her uncle died of cancer. And in this piece, what she's doing is she's showing the cancer cells. It's very large watercolor, probably taller than I am, this wide. And she's showing the cancer cells that took her uncle. This was her own way of healing. Jack mentioned artists using the art for healing themselves. This was her own way of healing with her uncle's death. But it's something that may resonate with a client. Doesn't always have to be realistic work. Okay, this is the fact. You know the fact. The big fact is that we're faced with our biggest disease. Responsible for cancer, strokes, accidents, murders, acts of violence, the list goes on and on. You know the list. You could have made up your own list. Okay? The big question is, for us today, is can art, it's a soft subject, can art, be a player in any way? Is it possible? If we look at art as a way to start a meaningful dialogue, then it helps. Okay, to start a meaningful dialogue, then it can help. Okay, I'm going to close my part of the presentation with two images. This one is Restoration of the Spirit. This image I selected for the last image in our book. The image by Mary Ellen Cox depicts the restoration of a painting. And she says in her statement that the restoration of a painting takes patience and time, just like the restoration of a spirit. I'm really proud of this piece. I'm proud of it because I'm an educator, and this painting is by one of my students. In this painting, Indomitable, the student is using herself as the subject, and she's covering herself with armor. But look at the armor. The armor is she's still vulnerable, even though she's tried to cover herself. She's still vulnerable. She got what the science world is trying to tell us, and that addiction is a chronic illness. You have to always be watchful. This student got that. She's communicating that message, and I'm really proud of her. Okay, and I thank you.